Hi, my name is Taylor Mastropolito, and today for my older adult oral video presentation, I will be discussing with you identity versus role confusion. Identity versus role confusion is Erikson's fifth stage of development. It occurs during the ages of 12 to 18, and basically it's a search for your sense of self and identity. You use your personal values, beliefs, and your goals to really help you find out who you are as a person and who you want to be. Erikson really talks about two identities that are involved with this stage, and they are the sexual and occupational identities. For my interview, I interviewed my mom, who is a nurse. And while discussing the identity versus role confusion, I really wanted to know her experiences with this. And, she talked about how from a really young age, she knew that becoming a nurse was something that she wanted to do. She knew that helping people was really important to her. She found out when she was around the age of 16, so right in the middle of the identity versus role confusion stage, that this is the path she wanted to take. She told me a story about how when she was in high school, she actually went and volunteered at hospitals. And from then, right then and there, she knew that the path was nursing, that she wanted to go down. She knew that it was the way that she could, fill the need that she had to, help others. And she knew that it was something that she really wanted to do as a person. When talking with her, we talked about like some challenges and some accomplishments that she might have faced while this. So after high school, she went on to obtain her nursing degree, her bachelor's in nursing, and she found that on her road, she found herself kind of contemplating whether this was the path she wanted to go down. Even though she identified herself as wanting to become a nurse, she wasn't sure if this was the right path. So, challenges she faced was really deciding if this was really, truly what she wanted to do and if she really wanted to truly become a nurse. But in the end, she did, and she finished and obtained her bachelor's in nursing. It helped her understand that, helping people is the path that she wanted to lead. She wanted to be in that role as a leader and a first responder and somebody that can help people on a daily basis. And the accomplishments she talked about was obviously obtaining her bachelor's in nursing and continuing nursing throughout her life. My mom's been a nurse for over 20 years, and she's been at the same practice for about 15 of those, and just recently she was named head nurse, and she says that's one of her biggest accomplishments from being a nurse. She knew that it would take her a while to get there, but now that she's there, she knows that this path was really the path that she needed to lead, and she really needed to go down. So a lot of times with this stage, people are faced with the questions of who am I and what does this all mean? Okay, I found out that this is what I want to do, but how do I go about doing this? And so on and so forth. And some people may struggle in this stage. Some people may find that they really don't know what they want to be and who they want to become, and they may struggle with finding themselves. Also, some may feel pressured by others to become something that they are not. A lot of times there's people who are in situations where their families force upon them what they want them to be, and that's, not really who they want to be. My mom is fortunate that, she wasn't in that situation, but, she told me stories about people who she knows that are nurses now that never wanted to go down that path. They wanted to do something completely different, but their families were so adamant about following the path that they wanted that, she really wasn't able to find herself in the way that she wanted to because she was doing what others expected of her. And that can cause people to end up not being who they want to be. And they can struggle to become who they want. And oftentimes people that fall on this path often times never become who they want or never find out their true identity because they took the path that others wanted them to take and they became who others wanted them to become, and they truly never found themselves. And a lot of times people can struggle with this, and this can really hurt people on their development, and it can cause them to, suffer this way. Some resolutions are, letting a person become who they want to be. Don't force people to become who they don't want to be. Let them follow their own paths and do what they want. My mom is a female, so going down the nurse road, never was anything she had to struggle with gender-wise because a lot of nurses are female, so that was never an issue. She's a very religious woman, and we're Catholic, and, in the Catholic faith, helping people is something, that we should do every day. So her religion really helped guide her in that sense. She really felt that God was kind of telling her that she needed to live this path of helping others and becoming a nurse. My mom's education played a big role. She went to high school and then obtained her bachelor's degree in nursing. And she said that, her college career really helped her better educate herself on nursing and better understand what she really wanted to do after she obtained her nursing degree. And finally, family. Family is really important for my mom. So my mom had a really supportive family system. My mom was really supportive of her. My papa was really supportive of her. And her brothers and sisters were really supportive of her going down this path. My papa was very sick when my mom was younger, and he was always in and out of the hospital, and he really valued the nurses, and he loved the fact that my mom was going to become one of these nurses who he just really thought was great. So she really had a great support system, which really helped her, resolve her identity issues. It really helped her validate that she was going down the right path, that she was becoming who she was supposed to be. So when talking about oppression, I feel like it's a tough topic to really talk about, but I feel like what people forget is that there's many different ways to talk about oppression, and a couple articles I found really discussed how oppression in nursing is a big thing. So the first thing that is really big in nursing is dissatisfaction with nurses. So what people are finding is that oftentimes people aren't valuing these nurses. They feel that they're not as educated and they don't have as much say as doctors. So oftentimes when people ask, oh, how was your nurse or whatever, they're often saying, well, I was dissatisfied with my nurse. She didn't do what I thought she should have done, even though she did exactly what she was supposed to do, or he did exactly what he was supposed to do. So I feel like that's a big thing. Another big thing in oppression in nursing is the favoring of physicians. A lot of times people don't want to talk to nurses. They feel that they don't know what they're talking about and that they want to talk to either a nurse practitioner or a doctor or a PA, and they sometimes kind of brush the nurses off when, the nurses know just as much as the doctors. They've been there, they know. Yes, they can't diagnose you like doctors can, and they can't prescribe things, but they know how to get you feeling better. They can answer certain questions for you that you may have, and oftentimes people don't want to hear that. They kind of just want to say, oh, I don't want to talk to a nurse, I want to talk to a physician, which can be really difficult for a nurse because that makes them feel underappreciated and not wanted, and I just think that's wrong for all that they do. And the third and final thing that happens is their intelligence is really challenged. Oftentimes people don't think that they're educated, that they have absolutely no background in the medical field, when that's completely not true. They do the they do schooling just like the doctors and the PAs and all that, and they know just as much. And like I said, yes, they can't do as much as physicians, but they can help you, and they do know what they're talking about. So I know it might not be the oppression that everyone thinks of and everyone kind of identifies with, but this is oppression in nursing, and how this can really hurt them identifying themselves as a nurse. Oftentimes when this happens, people, the nurses seem to get down on themselves and think, well, maybe this isn't what I was supposed to do. Maybe, nursing wasn't for me. And sometimes their identity can be challenged because of this. So, it is something to think about when dealing with this type of situation. So, a lot of things helped my mom decide that she wanted to become a nurse and really identify as that type of person. Like I talked about before, her family, really supportive. They backed her up in all that she did and really helped her pursue that career. But another big thing that she actually talked about with me that I found really interesting was she talked about the community and who she surrounded herself with. She talked about how important it was for her to surround herself with positive people that continuously encouraged her and, told her that this was, her calling and this was her path in life. Because she said that really helped her validate, who she was as a person and who she wanted to be. By having the community back her, she said that, that was a big thing in, pursuing the career that she chose. College, again, that was a big thing for her, picking the right school. She said that, at first she wasn't sure, but as soon as she started her nursing classes, she knew that the college she chose was the right one for her. She knew that, they had her best interests at heart and really were, going to help her pursue this career and help her really, identify as the nurse that she wanted to be. In society, again, oftentimes society can, not really support you, but, when you have people backing you and, being there, I feel like it's easier to identify who you want to be, and it's easier to, say who you want to be when others around you are being positive about that. The other stage that I chose to talk about with my mom was the intimacy versus isolation stage. And this happens at ages 18 to 40 years old. And, what really happens is you forming intimate relationships with others, you share yourself with others, and, completing this stage can result in happy relationships, commitments, safety, and care. And, the reason I chose this was because I felt that this was really important to somebody becoming a nurse. When you become a nurse, you need to be able to connect with other people. You need to be able to form those relationships and share yourself with others. You can't be somebody who's always locked away and not able to, really connect with the person that you're caring for. And I feel like by completing this stage, you can really become a successful nurse. When talking to my mom, she felt that she really completed this stage in her early 20s when she was right in like the prime of like her starting of her nursing career. She felt that she really was able to form the relationship with patients, and she was able to share herself with others, and vice versa. And since then she is able to have happy and healthy relationships with others, and she is able to care for others in a nurturing way. So she felt that this was an important stage, as well as the identity versus role confusion stage, because she felt that they both really helped her become who she was as a person.